This is a production of WKNO Memphis. Production funding for Behind the Headlines is made possible in part by the WKNO Production Fund, the WKNO Endowment Fund, and by viewers like you. Thank you.
The future of Medicaid, education reform, and more tonight on Behind the Headlines. I'm Eric Barnes, publisher of the Memphis Daily News. Thanks for joining us. We are joined tonight by State Senator Brian Kelsey. Thank you for being here.
Thanks for having me.
And Bill Drees, senior reporter with the Memphis Daily News. We're going to start with a decision this week, Brian, that the governor came out this week or last about Medicaid and the expansion as a part of Obamacare. And Bill, I'll turn to you. Tell us what the governor decided and some of his reasoning.
Well, the governor decided not to accept the Medicaid expansion. Medicaid in Tennessee is called TennCare. He decided not to accept that money for now. He indicated that he has been talking with federal health regulators and the Obama administration for quite some time about this very important decision, and that they could not come to an agreement for a variety of reasons. Let's take a look here at just what the governor outlined as some of the specifics, that the basic context in which he was looking to make this decision.
Instead of insuring more people through an inherently flawed system, we had hoped to purchase private insurance for as many as 175,000 more Tennesseans. To do that, HHS says we have to provide additional benefits above and beyond what everyone else in the exchange will receive. We'll also have to follow certain Medicaid-driven guidelines when it comes to copays and the appeals process, instead of allowing those individuals to be treated like everyone else in private insurance plans. The end result is that these Tennesseans would be receiving service from both the private insurer and TennCare. We have experience with that sort of scenario today in the form of dual eligibles, people who receive both Medicare and TennCare. It's dysfunctional, and it's not in the state's best interest to set that up again.
And so there you have the basis for the governor's decision at this particular point.
And Senator, you were happy with that decision. You did not want this expansion to happen. Why?
Well, this is simply a fiscal issue for me, and the state of Tennessee cannot afford this expansion. Even our small portion of the cost would be at least $200 million a year going forward, and that's $200 million a year that we don't have in Tennessee.
$200 million from day one, because what the federal government says, what they promote is it won't cost states anything. We're going to cover 100% of the costs for the first, I think, 4 or 5 years, and then it begins to come down to we'll cover just 90%. But you're saying $200 million from day one.
Well, no, they do claim to be covering the 100% for the first 3 years, and then it tapers down to 90%. But that 10% is still $200 million, and that is money that we don't have in Tennessee. And that's assuming that they keep their promise of 90%. And I just don't think there's any way possible that the federal government is going to be able to keep this promise to pay even the 90%.
And what a number of people said, and we'll hear some more from the governor in a second, but a number of people have interpreted what the governor said as no for now. Some governors in some states, and this was just sort of people haven't followed this closely, it was a state-by-state decision coming out of the Supreme Court decision about Obamacare last summer. We'll kind of stay away from all those details. State by state, some have said we want this money, some have said no, some have not decided yet. Some who said no, some governors said no from day one, I'm not doing this. Clearly, Governor Haslam was trying to work with and get a different deal and do it a different way. Are you open to that? Are you open to, if this can be done in a way that you see or that the governor sees as more beneficial, that's a good thing to do? Or are you against it in any form?
Well, obviously, it would be better to have this population on private insurance than it would be to have them on Medicaid, which we know is a failed program. But the problem for me, again, is the fiscal problem. And the point is we're spending money that we don't have. And if you think, as I do, that the federal government is not going to keep its promise to pay 90% of the cost to put people into public insurance, then certainly there's no way they're going to possibly keep their promise to pay 90% to put people into private insurance.
What about the argument I've heard, and again, we were going to have some other folks on here who are on the other side of the issue and couldn't work that out, so I'll play the role of foil to you today. What about the people who say, well, if it's for 3 years they pay 100%, After those 3 years, Tennessee could drop the program. If that sliding scale, that increasing number, the 200 million is too much for Tennessee 3 years down the road, they can drop this program completely. What about that? So have 3 years of good coverage is better than no years of good coverage over the next period of time.
And I just think politically that's totally impractical, and it's really not the right thing to do for these Tennessee citizens either. I mean, to hand them something that you know you're going to have to take away in 3 years is really irresponsible. My first year in the legislature was 2005, and we had to cut 175,000 people off the TennCare rolls. Governor Bredesen did that. It was very, very difficult to do, and it was an awful experience, and it's one that none of us in the legislature who were there want to have to go through again. And even Governor Haslam has been very upfront about saying that that's not a feasible alternative to simply give this coverage for 3 years and then take it away.
We've got one more clip from Governor Haslam. Why don't we play that, and we'll get some reaction to that now.
The whole reason to accept the federal dollars would be to leverage them to shape and impact health care coverage in Tennessee. All we're asking from Washington is to allow us to use the funds to provide coverage on the healthcare exchange in the same way that other Tennesseans will access coverage whether or not we expand. It is a very reasonable ask.
And so what in part the governor's describing there is, and you just talked about private insurance, what some folks, just because it's regionally, it's close, the Arkansas model. Arkansas has gotten a little bit farther ahead, it sounds like. There's a lot of vagueness to these conversations that the state have with the federal government, but that Arkansas has a further along a conversation about using the money for private insurance, avoiding putting more people into Medicaid and some of the complications there. Again, do you know the Arkansas model? Is that one that you think you could live with?
Well, again, the problem with the Arkansas model is that the funding is not going to be there from the federal government in the future. And I think it's actually much less likely that the funding will be there in the future from the federal government for that type of plan.
Okay. Bill.
So, Senator, where is your legislation to effectively say no to Medicaid, period, no to the Medicaid expansion, period?
Well, that legislation passed through the Senate Commerce Committee just a couple of weeks ago, and it was amended, and then it moves on to the Government Operations Committee, and that's coming up very soon.
Okay. The legislature has to make some kind of decision on this because it's a budget item, correct?
That's right. And so, this legislation is not going to pass both chambers this year. It's basically being put on hold and on reserve for next year in case it is needed, because the governor made the right decision in my mind this year. My concern is that we would have some sort of irresponsible expansion of Medicaid possibly introduced next year, and if that's the case, then I plan to move forward with this legislation, because yes, as of right now, the only vote would be simply a vote for a larger budget in the legislature.
How much discussion did you have with representatives of the hospitals? Because they were very vocal about their belief that the governor should accept this expansion of Medicaid.
Yeah. Well, certainly they came and talked to me, but I think my position has been very clear from day one. And again, for those of us who were there in the legislature in 2005, I think this is a very different conversation from the conversation that took place with those who were not there at that time. And this is just, it's something that Tennessee has experience with. We've been down this road before. TennCare, it ballooned, it took up a third of our budget at one point, and we had to pare it back, and it was very difficult to do. And now, we're in that situation again. But, as I've said before, I don't represent these hospitals, and I understand this is a very powerful special interest group. There's no doubt about it. But I ultimately represent Tennessee taxpayers.
You mentioned the hospitals, and just coincidentally, the Daily News on Thursday hosted a seminar about healthcare reform. We had a number of folks from Baptist Hospital, from the med, insurance side, benefit side, and so on. And it was interesting. I mean, the hospitals, they talk very much about how they would like this to happen. And their point is, in part, that they're already covering people who don't have insurance, that they are essentially required. It's some combination of ethics and legality. If you walk into the hospital, Baptist or the Med or any Methodist, any of the local hospitals, they're going to cover you, whether it's a stub toe or it's something much, much more serious. What do you say to them when they say, look, this would help us out because we're already covering those people, and they're going to get care from us?
Yeah, well, they're right right about that. I think there are 2 points, really. The first one is I'm not sure they're doing the math correctly on this one, because there are a large number of the people that are in this expansion population that actually are receiving private health insurance right now. Now, we took testimony on my bill from Mr. Cannon from the Cato Institute, who said that 82% of them are receiving private health insurance. I don't know whether that figure is accurate. That seems a little high to me. But nonetheless, a number of them are. And so once you push those people, if you did end up pushing them into a Medicaid route as opposed to into this healthcare exchange route, then once they're eligible, their employers are going to push them out, and they're going to, and then the hospitals lose that money.
Let's hear for a second from Susan Cooper, who is Chief Integration Officer at the Med, talking about the Medicaid expansion at our forum.
We already have a strategy for looking at how to bring care to the community. So we want people to have access to primary care services in the communities in which they find themselves.
And the part of the bigger point that Susan makes is, and that a lot of the people made at this forum, and I've heard other people make, is this Medicaid money would allow them to do not just pay the bills of people coming to the emergency room, but it would get people out of the emergency room. And there are lots of these studies that say that's the least cost-effective way to treat someone. That someone goes to the emergency room with the flu, and that's can be dangerous. And it's if your child has the flu, you're very worried. You want to do anything, but frankly, they'd be better off going to their physician or so on. And that the emergency rooms in Memphis and all over the country, the Med particularly, but all of them, are filled with people who really aren't in an emergency. They just need a primary care physician. And so that they see, and I'm getting way into the weeds of this here, but they argue that if you expanded Medicaid to these people who don't have insurance, you would ultimately see all these cost efficiencies. You would see all these people going not to high cost care in an emergency room, but lower cost care at a physician. Does that math not work for you?
Well, I actually agree with the hospitals on a lot of their argument. I mean, you're absolutely correct that because of the federal EMTALA law, they have to treat anyone who comes in the emergency room. And because of this Obamacare legislation that was passed by the federal government, they lost a large portion of what's called their disproportionate share payments. So they lost a lot of money that way too. And and then you have the U.S. Supreme Court decision, which they were not too happy about. But at the end of the day, those are arguments to take to Washington. You can't bring those arguments to Tennessee and to the Tennessee legislature. I don't have a vote on any of those things. And so at the end of the day, my responsibility is to protect Tennessee taxpayers. And because the U.S. Supreme Court gave us this opportunity to protect taxpayers, then that's what I'm charged to do.
Okay, Bill.
So the governor is going to continue his talks with the Obama administration. Realistically, do you think there's any chance the Obama administration is going to work in favor of or toward any kind of plan that involves private health insurance?
Well, with Arkansas, they have been open to the idea of private health insurance through the exchanges, but obviously they don't envision private health insurance the same way that Governor Haslam does. And just to be quite blunt about it, when you look around the nation at the states that have been able to work out certain deals, they seem to all have Democratic governors that are involved, and so I'm not sure whether that's playing a part or whether that's purely coincidence. But I think it seems unlikely at this point that any deal will be able to be worked out.
What have the discussions been like between you and the Haslam administration with your legislation and his decision?
Well, Governor Haslam was working on this issue for a while, and he and I discussed it. I laid out the reasons as to why I felt that Tennessee could not afford this, that it's just going to crowd out money that now would not be able to be used for education, for transportation, for public safety. And he listened to that, and he certainly had sympathy with those arguments. He's obviously hearing from this very strong, very powerful, very well-funded hospital lobby as well. And so out of deference and respect, I held off on the legislation to give him some more time. But I mean, we ended up being one of the last states to make a decision on this. And ultimately, the Obama administration was unwilling to work with him on this. And I'm actually happy about that.
He also heard from Shelby County Mayor Mark Luttrell on this. Had you talked with Mayor Luttrell about this as well?
Yes, I've discussed this issue with Mayor Luttrell, and I received his letter in the legislature in which he lobbied very much in favor of Medicaid expansion, and he and I just fundamentally disagree with that. And I understand he's charged with taking care of Shelby County taxpayers and making sure that the county budget is working, and so he's concerned that this will have a negative impact on the county. But ultimately, I'm charged with making sure that the Tennessee budget works.
Well, you mentioned the Cato Institute, which is a conservative think tank, Heritage Foundation, another conservative. Now, some of those folks associated with them, and I'm not putting words in your mouth, but on the very conservative side have said, look, this is also, I mean, it almost goes back to the election, the makers and takers kind of idea, the idea that you get one more entitlement and then that's a disincentive if people are getting insurance through the federal government or funneled through the state, that's a disincentive to get a job that would give them insurance. Do you see that at play, that entitlement taker mentality in this, or is it more a fiscal issue?
Yeah, I mean that to me is much less relevant than the fiscal issue here. I mean we've done this before in Tennessee. TennCare almost bankrupted this state once, and we do not need to put ourselves in that situation again. There are all these other factors that are going to expand our costs as well. I mean, there's the woodwork effect, is what it's known as. People who now who would be facing a tax if they don't go ahead and sign up for TennCare,
Right.
even though they're already eligible for it, they're going to be coming out. That's going to be several, at least another couple $100 million.
Look, we talk about taxpayers, the state, and one more point that the hospitals will make and other people will make, advocates for this Medicaid expansion, is that this is a jobs opportunity, that a huge number, that the more people who come into the healthcare system, who are coming in now in these inefficient ways that we talked about, if they come in, the hospitals project these huge numbers, tens of thousands of hires from nurses aides up to physicians. Does that sway you at all?
That to me is just a silly argument. I mean, when you take $1 away from one person's job and you give it to another person's job, then you're not creating a new job. You're just moving the money from one pile to the other pile.
Okay. Well, let's move on to the session is on a very fast track, which we'll talk about that in a second. But you guys are wrapping up a lot of issues, but there's still a few open questions. One big one is, of course, education reform, and specifically, let's talk about vouchers. You were on the show some months ago, maybe earlier in the session, talking about the voucher program. The Haslam administration had a task force you were on, I think, last summer. Where do things stand with the proposed voucher program for the state of Tennessee?
Well, unfortunately, Governor Haslam decided not to run his particular voucher bill in the Senate Education Committee, and that was, I think that was really unfortunate. It's very disappointing. But this legislation and this idea is not going away. I've been pushing it for the last 8 years, and there are many others who've been working on it a lot longer than I have. And so we will eventually give these children this chance.
So nothing. You see nothing happening this year.
I think it still is very much procedurally possible this year. It's going to take legislators who are willing to make that lift. There are other vehicles out there, other bills that can be amended to.
And give me again the 10-second, 30-second summary of your bill and how it differs with the Haslam administration.
Well, I never actually had a bill. In fact, and so we did have a bill that passed in 2011 through the Senate that I did sponsor, and that would have covered the 4 major counties in Tennessee, and it would have covered all children who are eligible for free and reduced lunch within those counties. So that would have been a huge number of children right here in Memphis and Shelby County. And then Governor Haslam's plan was a bottom 5% of schools plan, and these failing schools models have not been terribly successful in other states. I mean, Florida enacted one in the first year. They enrolled 56 students in the plan. So that was my biggest concern administratively, was that this was not going to work.
And Ron Ramsey, Lieutenant Governor, your boss, if there is such a thing in a legislative body, he wanted to really expand it more, get it up into the middle class, folks, and not just focus on people at the lowest end of the economic spectrum. Was that something do you see that happening at some point? Do you see a lot of support for that?
Yeah, it's really interesting because when you talk to some of these legislators, after a little while, you realize that they're actually calculating in their heads whether or not their children will be eligible for this program. And so
is that a good thing?
I think that is, I think that is helpful, that they realize, wait, this is something that could potentially be for others as well. But my focus has always been on low-income children, and so the income level was never really that important to me. But it was just, how many of these children can we help?
And the voucher, just quick numbers, would be worth roughly how much?
About $6,500.
And going into being able to be used in eligible schools, private schools would have to come out and kind of meet certain eligibility and accountability requirements. Is that correct?
Yeah, obviously the private schools would have to opt in to begin with, but yes, they're on the back end. They would have to show some growth among these students.
Did you hear from many schools, say in Memphis or throughout the state, private schools saying, "Hey, we really want this," or were they kind of neutral? I heard anecdotally from different schools, some very positive, really wanted this to happen. Others weren't sure they were ready for something like that, to bring these kids in. Well, what did you hear?
Yeah, I mean, a lot of people are simply not familiar with this idea and this concept of an opportunity scholarship, but actually there are a number of schools here that were very interested in it. The Catholic Jubilee schools were very interested in it. You've got places, some of these other schools that would benefit as well. Okay,
Bill.
Off the Senate floor for a second to the topic of auto inspections, which you've been involved in. The State Department that's in charge of the State Department of Environment and Conservation has told the county we can't do this for 2 years. And the City Council's made its decision to end funding for auto inspections at the end of this fiscal year on June 30th. Somehow in this discussion, the time frame of city-only auto inspections for 6 years came up. And Mayor Luttrell says our talks have always been about 2 years. County commissioners have said 2 years. What can you tell me about six years in which things essentially remain the same?
I received a hard and fast commitment from the commissioner that this will not happen for 6 years, and I believe him.
Okay, so this came from the TDEC commissioner.
Exactly. It came straight from the state, and I even went back and verified it after I read all the reports of 2 years. And I went back and I discussed it with him again, and he said, yes, absolutely, 6 years. So I feel very confident that that is the right answer. And down on the county level in Shelby County, they can discuss whatever time frame they want. But I feel 100% confident that this will be the case for 6 years.
Well, and Mayor Luttrell has basically said that while the county has had talks with the state, this is a state decision, unless the county decides to get into the auto inspection business.
That's correct, yes. I mean, the county is deciding to hand it over to the state, so ultimately the commissioner is the one who's going to make the final decision. And it's mainly because just administratively it's going to be very hard to do. And when you look at the timeline in terms of when the EPA guidelines and their new regulations kick in, it just would be hard to change the program in the next 6 years.
Do you think there's a fairness issue? Do you think that everyone who drives a car or owns a vehicle in Shelby County should have to have their cars inspected?
I think there's a real fairness issue, and that I don't think that anybody should be having these inspections because there's very little scientific evidence that they have a positive effect on the environment. And so my goal was always to be a win-win. I wanted to keep the county residents out of it for as long as possible, and I wanted to keep the city residents, I wanted to provide them with more locations so that they can do it a lot easier, because it's just a pain, and there's no reason we should make it that difficult on people by only having 3 places where you can go.
I just did that the other day, by the way, to get inspected, and they plugged in the computer, and actually the inspection took far less long than I would have thought, but the line took forever. That was just a little, firsthand reporting there. A question back to schools for a second. The municipal school bill, the idea of getting rid of the cap on the formation of municipal schools goes back to Norris Todd, and I haven't been front and center in this, but you represent the suburbs. Obviously, the suburbs, by and large, very interested in getting this cap lifted. What's the status on that bill right now?
That bill has now passed the House and the Senate Education Committees, and interestingly, in the Senate side, it received a unanimous vote, and it received bipartisan support. So I think the thought is in the state legislature that there's really no need to have this ban on municipal school districts in Tennessee anymore. The smaller school districts tend to perform a lot better than others, and so as a statewide policy matter, we should simply get rid of this ban that was put in place back in the 90s.
And so it looks like it's moving forward pretty quickly.
It looks like it's going to pass, but it has not come up for a floor vote in either the House or the Senate yet.
And you hear from your constituents, and they, by and large, want this to move forward because this would allow them, and for those who don't follow this as closely as we do, a year from now to break back out of the unified school district, so you could have a Collierville school district, a Germantown, and so on. I assume you hear from your folks that they want that.
Yeah, well, obviously the ones who live in Germantown, they voted almost 80% in favor of this, and so yes, that tends to be about the same proportions that I hear from them on.
When you watch what's going on right now, the schools they are merging in their way. We have an interim superintendent, Dorsey Hobson. Do you watch with great concern, or for how this next year? Let's assume for a second that the suburbs will break back off in a year. Are you worried about this school year ahead for the kids in your district?
Well, I'm very concerned about the current school board and their inability or unwillingness really to enact a lot of the recommendations that were made by the Transition Planning Committee, because I think that was a very good plan put forward.
Yeah. A couple more. We just have 2 minutes left here. gun control, it's been a huge issue, guns in parking lots and so on in some past years. It was not a big issue this year. Your take on the bill that was finally passed that allowed guns in parking lots with some conditions?
Yeah, I think it was a pretty good compromise, and so and I'm glad that we were able to get that done fairly quickly.
And was that the fact that it was so non-controversial? I guess from this a media point of view, maybe, I don't know, but is that just a reflection of the supermajority? I mean, the fact that Republicans dominate the Senate and the House now, and that so some of these things just there isn't going to be as much fighting about it because there are a lot of like-minded people on these issues?
Well, and so many of these bills passed in years past. I mean, there's only so many left that you can really legislate at a certain point. So I'm glad that we've been able to move on to other issues like education and like healthcare.
Okay, Bill.
Just a real quick hit on the municipal school districts bill. There was some anticipation that you all would hear a lot from the other major cities in the state about this, that there were some concerns there. Have you heard those concerns from Nashville, from Chattanooga, from those other areas?
There were some early words to that effect, but I personally have not heard anything at all, and obviously they're not too outspoken because these bills have moved as far as they have already.
Last thing on this, Ron Ramsey and Beth Harwell, the head of, Speaker of the House, said last year they wanted to get the session done quickly, and they did. This year they said they want to do it. Okay, that was great, but we want to do it even faster. And I've heard from people, I'm up in Nashville sometimes, that it's just breakneck speed. Is that been, I mean, you've been up there, you said since 2005, first in the House, now in the Senate. It's going at 100 miles an hour?
It really is. I mean, not only are we going to finish faster this year than last year, but you have to remember in the odd years, we take a 2-week break to rearrange a number of things for the committees and whatnot. And so we're still going to finish earlier. But a lot of it falls on me, actually, because as the chairman of the Judiciary Committee, I get more legislation that comes through my committee than any other.
Right, all right. Well, thank you very much for being here. Senator Brian Kelsey, we appreciate it. Bill, thank you. Thank you for joining us. Join us again next week. Good night.